They told us that this new experimental CAR T-cell therapy had just been approved the day before, and that Emily could become the first child in the world to have this type of treatment. April 17th, 18th, and 19th of 2012, she received her modified CAR T-cells back, which made her very sick, and she ended up in the intensive care unit for 2 weeks on a ventilator, breathing for her, but she just kept fighting, and the doctors all worked together and figured out a way to treat the side effects. And they said her system became overwhelmed with cytokine release syndrome because over 3.5 pounds of her body weight was cancer.
That kind of fighting spirit, I mean, you know, how do you feel about that now, looking back?
That was really important to me, and my dad always told me we need to stay positive and find something to smile about every day, and I think that that does have a big effect on, especially whenever you're in the hospital.
She woke up from a 14-day coma on her 7th birthday, which would have been May 2nd of 2012. And then 8 days later, 23 days after her first infusion, they checked her again, and she was cancer-free.
The clinical and the scientific community were essentially taking your immune cells, bringing them to a lab, genetically engineering them, turning them into super T cells, right? And then giving them back to you, and then your own T cells essentially fought back, were able to fight back at the cancer, and it's been working ever since.
It's been 10 years, and I have been waiting for my B cells to come back because I have to do a medicine every 2 weeks because I don't have any, but 10 years later, the T cells are still in there.
I posted one day, you know, I believe I'm witnessing a miracle with Emily's treatment because, you know, they told us she couldn't survive, and here she was becoming the first child in the world to have her immune system trained to beat her cancer. And it sparked the cancer immunotherapy revolution.
I think it's important to tell other kids how important it is that they believe in themselves.
We were receiving letters from soldiers that said, you know, Emily, people tell us we're heroes, but to us, you're our hero.
We met President Obama a couple of years ago, and he asked me...
Well, President Obama met Emily Whitehead.
Yeah.
That's right.
He asked me, what can I do for you since you came out this way? And I told him that I had missed school, so he wrote me a school excuse that said Emily wasn't in school today because she was with me.
You've met Lady Gaga and other celebrities, but to me, you guys are celebrities, right? I'm a pharma geek. I geeked out when I heard your story. I feel like, you know, you're rock stars. You've been on the cover of New York Times. You're about to launch a movie at the Tribeca Film Festival. I
got to spend a day on set with Steven Spielberg whenever he was filming West Side Story. And that was probably the day that I realized that that's what I want to do.
But it's not just about the Whitehead family and what you've gone through. You've also been, you know, really generous and giving of your time to other families in similar situations, and you've established the Whitehead Foundation.
Along with that media attention came parents calling. We finally started the Emily Whitehead Foundation to try to pay it forward every day and help other families have the same outcome as us and provide assistance when they need to travel, or just, you know, advocate for them so they can find these trials.
My main goal is to get less toxic treatment options closer to the front lines, especially like the effects from radiation can be really harmful, and my parents were more scared of that than they ever were of CAR T-cell therapy. But just getting kids back into their normal lives, back to school and back with friends is really important. And for me now, I would like to see more on the mental health side, better care for patients, especially pediatric and even adults too.
We were kind of put into this, forced into it, but since Emily was first and we saw the power of what her story could have, you know, we've kind of been, we've taken the reins and tried to do whatever we can to drive this revolution forward.
It really is a medical revolution, and we feel incredibly grateful to be a part of it and be driving it forward.